Hi, and thank you very much. My name is Joe, and I'm here to talk to you about common sense. And we need to learn that what we're being told, what's going on with the numbers of coronavirus cases and deaths, are not at their, they're not accurate, completely accurate whatsoever. Total cases are probably about 200,000 off. Deaths are about 25,000 off, and there's a reason for this. I'm going to explain. I'm asking you, do me one big favor. Watch the video. I'm trying to make it as short and sweet as I can. And share it with your friends, your family, everybody you can. Please share it on every single media websites that you have. We need to get this information out because nothing against the CDC governments, local or federal, but information that you provide to the people of the United States should be honest reports, not inflated numbers to try to keep us scared. We should be informed correctly of what's going on. That's it. That said, let's take our political hates or love for the president, throw to the side. Political hate or love for our governors or our states to the side. Like me or not, put that to the side. We're going to talk about common sense, numbers. Very simple. When we talk about common sense, we know 1 plus 1 equals 2. That said, we're going to use that basic understanding to the numbers that we're being given. I'm on the CDC website right now. It is May 14th, about 10:21 p.m. at night. I'm doing this because this is where they usually update everything, including cases. Here's what's going on. Any data that comes from the hospitals goes right to your county health departments. Then it gets to your state health departments that go on to your CDC reports. Now, CDC health departments of the state and health departments of the county cannot interfere with the numbers. In other words, they can't alter them. Once the numbers are coded, or in this case, deaths and cases are coded of what they are. If it's coded with coronavirus, there's a certain code for it. It's U017.1 or something like that. And then your flus and everything have a different code. That includes your death certificates. Problem we're having here is we are being told that this pandemic of the virus is severe, and it's not. A little brief history. If we go by the numbers right now, what we're seeing right here on this webpage, and I'm going to highlight cases to deaths, we are still not anywhere compared to, and I'm not talking about the 1918 Spanish flu, I'm talking about the Hong Kong flu. The reason why I picked that out of all this is because it's about the most similar type of pandemic we're having now. The difference is when they had the Hong Kong flu, that pandemic, nobody had social distancing. They had Woodstock, yet we still had 100,000 plus people die in the United States of it. And we didn't do anything we're doing today. We didn't have the government telling you can't go out, can't do this, can't do that, shut down businesses. I'm not a conspiracy theorist. I'm just giving you facts. And that's what my job is here today, to give you facts. Here it is right here. I go to this website called the Britannica, Encyclopedia Britannica. Grew up with it. That's how we went through school when we were looking for information, because the information that Britannica gets is always verified at least 2,700 times or more. They have to verify their information. That's why it's always updated. And I'm going to give you a quick history. You go to this website. It's up here. Follow the arrow. In 1968, 69, 70, almost 2 years, this influenza was out there. It was called the Hong Kong flu. Nothing like the 1918 pandemic, which killed 25 to 50 million deaths. But here's the thing about the Hong Kong flu. And it's right about here. When you read this, I'm just going to highlight the most important parts here. Although the get out there. Although the flu 1968 outbreak was associated with come to a few deaths worldwide, the virus was highly, I'm going to read this again, the virus was highly contagious. And it was very highly contagious. It was so contagious, within 2 weeks of its emergence in July in Hong Kong, 500 cases of illness had been reported. In 2 weeks, 500. Okay. Yet, they didn't, we, even as the United States, didn't shut down. We didn't stop travel. And the most important thing is, Woodstock was available in 1969. Proven fact. Right here. Woodstock. August 15th, 1969. August 18th, 1969. And yet, this ran for almost 2 years. And again, so what's going on? Well, I'm showing you this because we need to calm down and not get scared. We're seeing reports on TV about how this thing's being transmitted. We're being, and there was one report which was disturbing, that this lady on a news rubbed all her hands saying, oh, this is going to be a demonstration of how the flu can be transmitted. And they did this UV. The problem with that is if the COVID-19 was that much on your hand, that would be possible. But you gotta remember, they're talking about droplets, really microscopic droplets from your mouth, on your hand, and so forth. That was just so misleading. Sorry to go off on like that, but there's a reason. So here it is, and CDC reports the same thing. It's called H3N2. The website's right here. It says estimated number of deaths was 1 million worldwide, and about 100,000 in the United States. 100,000. We haven't hit that yet. No, we're not going to. They're saying it hit mostly with people in 65 years or older. I get no reports and other websites saying differently. It especially affected younger kids, high fevers, rashes, and so forth. Oh, it's right here. Infections cause upper respiratory typical influenza and produce symptoms of chills, fevers, muscle pains, and weaknesses. And it's, it's sad. It's one of those sad things. But I wanted to get to that because this is what I want to get to. I'm going to answer all your questions best I can. I'm here to tell you we need to use common sense. I'm not going to comment back on my post. Once I put this up, make as many comments as you want. I'm not going to answer them because I'm going to answer them all right here. Because I know you're going to have all these questions, and I'm I'm trying not to sneeze here. I hope to try to answer them all in one shot. I'm trying to make this video as short as I can, but there's a lot of information, so let's get right to it. So why are these numbers as high as they are? Well, let's start with the cases. This number case load right here is off probably about 200,000. And I'm going to prove it right now. Down below on this website, you go right down below. It's going to give you a number right here. That's the actual number of cases. It says data were collected from 1,097,512 people. Problem, you're going to say to me, but Joe, let's say 94% of that. No, they're saying 94% of this. This is the number. That's 94% of this where the age was available. That means is that when they asked people about their ages, if they could, they got the age. But when they came in and they were people that had never been in the hospital, nobody knew them, they didn't know. And that's 6%. That's about right. Well, how do we know that's the total number? Because it is, because when they do these case analysis like this, they have to have the total number. And here's where we get our confusion. It's easier for the CDC to do this because they have no control of these numbers. This is just somebody reading the data. Remember, the data comes directly, from the hospital through your health departments in state, county, then CDC. They're uninterrupted. They can't be messed with because they're coded. Quick thing, you're on a road, you're on a highway, you're driving from A to B, and on that road, you can't be stopped by anybody, police or anything, because you're the data. They can look at you and see what the information they get, and then they drive off and you keep going. And that's what's happening here. Now, this data right here, total deaths, is going to prove what I just told you. On the CDC website, once you get used to it and you know where you're looking, you'll find the actual numbers, and they are up to date. So, we talk about cases. Here's the actual as of May 14, 2020. We are at 56,977 actual COVID deaths without interference of anything else. And those outside interferences they look for is, if you follow my hand, deaths with pneumonia and COVID. Don't look at this over here because this has to do with another issue that they're doing, which I feel, in my opinion, is very irresponsible, and I'll explain. That's why these numbers are so far off. So, what's this mean? Well, this means here is the total deaths right now are actually 56,977. That's with people that have, elderly, emphysema, lung cancer, something that has to do with poor health, besides pneumonia. There's a reason they're doing this, because deaths with pneumonia over here in COVID-19 can't be determined if that person got the COVID first and then developed pneumonia, or did they have pneumonia first and somehow got infected by COVID. And because they don't have any testing regarding that information to help determine where it came or how that death happens, that's how they code that. And underneath you'll see these little codes, U01.7, that's COVID. Pneumonia deaths are J12.02, J18.9. That's just how they code things. And then your influenza is this code right here, and so forth. Well, what's this? Death from all causes. Like I said, they include COVID, pneumonia, deaths from motorcycle accidents to homicides to, drownings. That's all deaths. And that's from February 1st. Let's pay attention to the dates. February 1st. Look at pneumonia deaths compared to COVID deaths. They are almost double compared to that. Well, Joe, that's not updated. Yes, it's updated. I'll prove it. I took a screenshot of the same page on the 13th, which was yesterday. Okay, and what I'm going to do here is I'm going to show you that right now. And here it is. Updated May 13th, 2020. 54,861. You go today, it's 56,000. It went up 3,000 because it gets updated daily. That's what this is. So that's the actual total. Now, if you take this number here, you go over here to where it says deaths with pneumonia COVID and add this number, you're going to get close enough to this number. And that's where the confusion is. They shouldn't be doing that, because if that's what they're going to do, then they should also report pneumonia deaths are higher with this number because they're adding this number to here. Then they need to add this number to pneumonia to make it what they call a fair data. And they're not. Well, why aren't they reporting that? Because the best way to keep people at a certain level of control, and this is not conspiracy theory, it's just basic common sense, is if we show them these actual numbers here, and when they try to influence us to say wear masks, wear this, wear gloves, we're going to tend not to look at that advice. And that happens. It does happen. It has been proven in history. But also been proven in history is that when you lie or mislead, especially in the United States, to people that trust you with that information, you need to come forward or you make it worse. In my opinion, this number should be actually being promoted right now, because that's the actual deaths we have to worry about. This is because people with pneumonia and end up with coronavirus or COVID-19, they are going to, have complications. But the actual COVID itself is not the one we should worry about, because somebody that's healthy, and this is why they should do this, because what they should break it down is COVID and healthy people, COVID with this should be broken more down to see the numbers better. By doing this, this is one, confusing, but two, it also demonstrates that the actual deaths are lower than the reporting, and that it's irresponsible of the CDC. But can't blame the CDC all. It's not like the movies where you see where the CDC comes running in and say, "Hey, we're going to save the world," and they make these announcements on the news. They don't. If you've been paying attention to news, who's making announcements about the numbers first? Your local governors, and then our federal governments, like the president and so forth. And that's where the CDC does not make statements before the governments. They're always asked to make the statement after they made their own, to confirm or deny whatever. There's been very few history in time where the CDC has actually made reports before local governments do. So let's go on. I've talked a little bit more than I should, but you're getting to understand what I'm getting here. So those are the actual numbers. Here's the thing we have to look at. Here's the population right here, and this is broken down. Yes, this number is lower than this one because this one still is from the 13th, hasn't been updated yet. Like I said, it usually takes about 24 hours for some of this information, but this is, you're getting the understanding what it is. And they break it down. Now let's take a look here on the COVID and the pneumonia. So as you go up, here's our peaks right here. Mostly everybody from, I mean, the double digits don't even start here at 65. Okay, right here. Now pneumonia cases, if you look right here, which is the third one, are always higher. See this? Why is this not being reported? That's something that we need to stand up, and this is why this should be shared, this video. We got to say to our local governments, I got this report on the CDC website. This report is showing that pneumonia deaths are actually higher than COVID deaths directly. Why is it not being reported? Okay, I'm not a conspiracy theorist. I'm not here for conspiracy theories. Excuse me. I'm here to give you the numbers off the websites. Use your common sense. Like I said, again, just so you understand, common sense is, it does not make sense why reports on the news and the reports on social medias and so forth are not equaling what they're here at CDC. Hey, Joe, guess what? They're not fully updated. Yes, they are. Right up here it says National Vital Statistics Systems. Well, guess what? There's another company that works with this too, another, and they are called and I'm going to show you. They are the National Center, right here, the National Center for Health Statistics. Now, the reason why I jumped to this is, I'm going to go back here, the total deaths. And on the website, you get to a page right here, here's a number. You're going to come across this right here, understanding deaths, and understand how death certificates are filled out. You want the first one, because this gives you the guidelines of where they're coming up with the numbers. Good information, also scary information. First thing is, provisional death counts deliver the most comprehensive pictures of lives lost to COVID. The estimates, now these estimates are based on incoming death certificates, which are the most reliable source of data and contain information not available anywhere else. Anywhere else, they're saying. So they're saying, don't listen to the media, don't listen to that. It has nothing to do with that. Well, down here it tells you how it works, 50 states. Here's what we need to understand. This line right here first. COVID-19s are identified using the ICD-10 code. That's the code from the hospital that tells everybody when the COVID-19 is reported as cause of death, or when it is listed as, and this is scary, as probable or presumed cause anywhere on the death certificate. The death is coded as U07.1. Remember, that's the code. Excuse me. That's the code right there for COVID. Okay. And, oops, I am skipping way too far ahead. This can, here it is. It says this can, remember highlighting, can include cases with or without laboratory confirmation. That is irresponsible, because that means I go into the gun shop, I develop an infection, I get the fever, I get the cough. Yeah, if I die, even without a laboratory confirmation, they can still code me as having COVID because I had developed what they call the vital basic signs, which is cough, fever, you know, trouble breathing. You can develop an infection from a gunshot wound. Depends where you get shot. Okay, and it says right here, and here's you can see. Well, Joe, I'm reading this. I went to the site. Guess what it says? It often takes 1 or 2 weeks behind other data because, and it says, blah blah blah. Here's the thing: if that was actually true, if that's the case, and this is why they add numbers together, which I just explained, is because 83,947. If you take this number, add it to this number, you're going to get like 82,167. You're off about 1,000. That's where they're getting their numbers from, because they're adding these two. But Joe, again, it says right there, Joe, and I'm going to go right here. It says it takes 1 to 2 weeks. If that's the case, where are they coming up with these? Where are they coming up with these numbers then? If it takes 1 or 2. These numbers, I'm showing you. Why am I keep jumping around like this? Oh, because I wanted to get to this level. That's why. And I'm just going to kill that, so I'll just go. That's true. Then these numbers right here, including these numbers right here, should not match these numbers. Your case number, Joe, you just said. That's because this is the actual cases. What's happening is, and I'm going to explain this to you again, and here it is. On the cause of deaths, this can include cases with or without laboratory confirmation. That's not just including deaths. I guarantee you that's also including cases. But here's the kicker. CDC cannot control actual case numbers and control them because, because if they did, mind you, that's 300,000 difference right there. And I'm going to prove my theory to you about that too, anyway. See that number right there? That's the actual cases. Remember the definition. You're looking at 300,000. Most say 200 something. A while back, I've been collecting, as you can see, I've been collecting data for this for a while. We're going to go back to this right here. On their website, they used to have it like this. You can see the total number of cases. Now let's remember this. As of April, and this is the last time this has actually been up there, was April 25th. But 671,000, I'm going to blow this up right here just a little bit so you see what I'm talking about. Follow my arrow. Sorry, it's a little blurry. Totals, group years, number of total cases, okay? As of April 25th, come here, it was 671,485. Remember that. Because it's 671,485. There is a website. Right up here, worldmeters.info. Worldmeters.info. Excuse me. They got all the countries, the whole world, and the United States. We're at the United States, and I'll show you how accurate this is. 1,456,526 cases. 86,900 deaths is what they're reporting so far. And I'll show you how update that is because they're pretty close. They're about 3,000. But this is because they get their information also from the media. Recovered of so far is 317,988. They do what they called this right here is not right because they're basing this on cases closed, and they shouldn't. This number should be based on total population. Everybody knows that, basics. Okay, let's go down here. The thing about this is it's been keeping track since the beginning, basically. So we're going to go with total cases to prove my point about what's going on. 671 as of April 25th. We're going to go with April 25th. April 25th shows 960,651 cases. That's 300 cases off. You see the connection here? That I had to do some mathematical formulation on this, and I had to do some research, and I actually understood why the case numbers are higher. They call it the 2% plus higher, or sorry, 2% differential skew is because that's their what they call the error gap. If they make a mistake, at least they're off within 2%. Well, that's actually more like 22% because I actually had to do some more mathematical formulation. That said, that's 600,000. It's 300,000, and you see pattern here. That's off by 300,000, and mind you, this was updated properly that day, and the 25th was 900. Okay, that's scary. Now, on my paper here, I'm on my little go-to information here, all these screenshots I did. What I'm trying to show you is this is how dedicated I was of getting and taking my information from the websites only, and only the websites. None of this is made up. I didn't make up the numbers. This is CDC's websites and everything else. Well, Joe, well, so far you're proving them right that the numbers are accurate. No, they're not accurate, because if they were accurate, you wouldn't have this number here. Because this is irresponsible. It's irresponsible putting notices up saying that with or without laboratory confirmation, you can still be coded with a death certificate. This is why you got to talk to your governors and to your local Congress people and to your federal government. We as the people have a responsibility to see if our government is truly being honest with us and giving us our best interest at hand first. Well, they are. They are doing this. They're putting masks on. Yes. But why are we being quarantined as healthy people? Governor Cuomo recently said 63% of people that got infected have been at home. And he was even flabbergasted about that. Well, that's because you don't quarantine with the sick, because it's like an incubation. Again, this is not conspiracy theory. That's just common sense. Teaching you common sense here. So let's keep going. So, what I'm getting at is your numbers here. These are actual numbers. And I'm going to prove to you another fact about how accurate these numbers are. We're going to go to, and mind you, this is ages too. This is off a little bit here. But what I want to do, and I'm on the wrong page again, is down here. Here's the number, updated as of today. New York City is separate from New York. I don't understand why they're doing it this way, but that's fine. May 14th. As of today, COVID alone is 15,152. Deaths with pneumonia and COVID, 5,723. That's a total of 20,000. Here's the catch here. You go to the website of New York Health Department. You come and find this download data. You're going to go down here where it says updated May 14th. Okay? Where it says confirmed and probable deaths. Okay? You're going to open up a PDF file. It's going to look like this. Down below here, right here, it says 15,000 confirmed. Probable 5,057. That's 20,000. That's the same as here. Up a little bit more. I think what happened was here is they updated it a little bit better, because remember, they get direct information from, just like, I said before, 5057. Let's double check some numbers here. 5050. So it's up by 200. But you see what I'm getting here. It's still 20. Here's the thing. These were confirmed. Here, see this? Deaths with pneumonia and COVID. They call it probable. Same number. And then, of course, they break it up. If you ever been on this website, you've read this. This is a requirement for federal directors, report in 872. However, due to the pandemic, there are some delays in reporting. We know this. Whoops, go back here. Deaths not known to be confirmed or probable COVID or 13. They're saying there's 13,000 deaths not related. And here's where they said a death is classified as probable if the descendant was a New York City resident or New York City resident who had no known positive laboratory tests for COVID-19, but the death certificate lists the cause of death COVID-19 or equivalent. This is why it's so important to understand. That is so misleading to the public. You don't put something on laboratory. You don't put down a death certificate if somebody died of something if you don't have it confirmed. It's like me saying, I'm your doctor. You come to me. You got lesions on your face, on your skin. They're breaking. And the first thing I say to you is, that's cancer. We're going to treat it. And there you go. Irresponsible. Without laboratory test. It's irresponsible to you as citizens of the United States. Common sense. We need to question our government. We need actual real numbers. Because the way they got this all confusing here is tearing the country apart. And it's not right. I did this to confirm the facts. Common sense says, why aren't these numbers making any sense? Why aren't we doing what we need to do to understand more about this disease? Well, the best way to control your own fear is control everybody else's. It's sad. So what's going on, Joe? All the information thrown at us kind of verifies that there's these many cases. Yes, they might be off. They're doing our best interest there. But the fact is sometimes when you overprotect something, you might do more damage than good. And the other fact is, and there's the scary part, when you don't properly handle, and this is this is not even an opinion, this is just a fact. If you don't properly handle a condition as a professional doctor or physician, and you mistreat it, people do die. And it's sad. Down here below, whoops, wrong page again. I did it again. Keep doing that, and I got bad habit. Down below on this page right here, I'm going to read this. This is as of May 13th. So don't worry about the numbers, but you have to look at the actual, but the total overall numbers. Healthcare setting inpatient. That means hospital. 36,000 deaths from COVID deaths alone. Pneumonia deaths for 54,000. It's still higher. It's ridiculous. Inpatient. And then you got the pneumonia, you got 18,000 here. Okay. Healthcare settings outpatient or emergency room is only 2,000. You go down here. Nursing home, long-term care facility, 11,000. Here's the common sense right here. What's happening? Are people dying of COVID because they're dying of this direct COVID because, especially in nursing homes, because it does affect the elderly. We saw that. I showed you. I can actually show you on right here. See this right here? It shows you the amount of, deaths based on, oh wait, that's male, excuse me, all ages. See the high numbers right here? The only time, and this is the scary part, pneumonia is the third column. Pneumonia outdoes these ages. Right here and right here. What's going on? It's the age factor. And it is. And it, as you get older, your immune system, that's all it is. But I'm going to inform you right now, and you read the information off the CDC website right here, that death is coded. This can include cases with or without laboratory confirmation. If I'm in a nursing home, I die. And if I don't get a laboratory confirmation that I died of COVID, they're still going to mark me in. Because if I have a cold or anything. And it's sad to say that they allow that Again, kind of off topic here, because the more I do this, the more I realize that it's just numbers are just not making sense. Because I'm going to show you something here. Here's our dates right here. You can see the ninth is still not fully updated yet because the end of the ninth week. Excuse me. Because if you read right here, it says, well, Joe, it says week ending here to here. Why is this so low? Well, because they're doing it once this week coming up. Friday ends, okay, which is going to be the 15th, 16th is when they're going to have updated ads this week, because they'll have all the information basically updated for that. Because this number right here, I'll be totally honest, this number right here was actually lower last week until they started the end of this week. But this total right here is up to date. This total I just showed you, you add this number and this number, you're going to get this number. These are up to date. I can guarantee you that, because they have, I'll explain to you how much has been up to date, because I already showed you once already that between the May 13th there was a difference of 3,000, I think it was 2,000, 3,000 deaths. So they do get updated daily. Yes, I'm rambling on a little bit. It makes me upset, because I like to trust the CDC. I like to trust our government to, do its best for us. But the numbers never made sense in the first place. We are in a situation where we are, we're confined to our homes, very little socialing, social distancing and stuff, and it doesn't add up. COVID-19 direct deaths without interference with pneumonia is only 56,000 as we stand right now. Pneumonia deaths, again, are higher than the total deaths of COVID. Yet we're not hearing anything on the news about this. This is the website. All this information is here for you. Just go to CDC and search. And it took me a while. I'm not going to lie. It took me. I've been doing this since, I'll tell you when my first, let's see here. Let me see something here. 418, 425. So, I've been doing this since at least, I'm going to get my earliest document here. This is my earliest document regarding this. I've been doing this since April 3rd. So I've been doing this way over a month of nothing but documentations and documentations and documentations and documentations, studying it, learning. I've now decided to do this for you people. I encourage you, please share this with everybody you can. Pass it on. Ask your local governments, can you please investigate this? Why are the numbers not making sense? Why are the websites on the CDC saying, oh, it's taking this long, but yet, at the same time, if you look at it and they're saying all this information, that it takes this long to do it, but yet the next line it says, well, 80% of the information. Here's nothing, and I've said this, I'll say it again. 80% death records are coded electronically at the NSC within minutes. Within minutes! And they said the most is 7 days. Well, yeah, I'm proving that right now. It's been more than 7 days for these, and these are the actual numbers. These are the dates. And again, pneumonia is outweighing most of this, except for this one period, and this is our right here. This is our peak period right here. And now the reason why we have that peak period, before we go, and I'll show you right here, and the deaths, especially we'll go on the deaths, is right here, this peak period of the deaths. The reason why this happened like this, and the way we jump from here going down, is remember, we panic buyed. And we did. You go back to even March and April when we'll go back to cases here. We're back in February, that the cases and the infections jumped because we panic buyed. What's the first thing we did? We went out and bought toilet paper, of all things. You take and look on YouTube and any place else like that. Look at their and type in panic buying. Look at the dates that these things happen. You'll see people frantically with no mask, no social distancing, in lines by the hundreds and the hundreds. That's how it spread so fast. And that's sad too, because we should never have been in panic. Thank you very much for watching the video. I do appreciate you guys taking your time watching this. I'm sorry it took longer than I wanted to, but the fact is I wanted to make sure I threw enough information. So let's end all this extra talk. And once again, thank you. Share with your friends, share with your family, share as much as you can. The more information we get out to our people, the more common sense that we need. Because 1 + 1 = 2, and these numbers are just not making any sense. Okay? Thank you again, and good night.